ready.
So Dr. White is just finishing up his sutures here on our patient. So while he's finishing up here, we're still maintaining the animal on ISO and on oxygen. So our animal is still hooked up while we're suturing, and our animal has been on a little bit of a light stage of anesthetic. It's still in the stage 3 plane 2, but it is a little bit light, so we're not going to be turning the ISO off for quite a while here, just because we want to make sure that we give this patient the best recovery that we possibly can. A few things to mention for the recovery process is it's very important that this animal stays warm during the anesthetic recovery, and that we have a safe kennel for the dog to go in. So we want to make sure that that kennel is going to not have any water bowls, any food bowls, or anything that the dog would potentially choke on, and that it's nice and quiet and ideally dark in there for the patient to have a nice slow recovery process. So we're going to be giving the patient a couple of medications. We're going to be giving a long-acting antibiotic just as a prophylactic measure. So we're going to be giving duplicillin as an injection. We're going to be giving Metacam as an injection as well. So because the butorphanol only lasts about an hour to two, it's going to last long enough for the procedure to be done, but we want to make sure that the patient is actually covered with a non-steroid anti-inflammatory for after the recovery process. While the animal is on the table here too, it is really important that I am still monitoring my patient. So I'm just going to continue listening to the heart rate and the rest rate of my patient. So I've got a heart rate of 86. My machine here is saying 83, very close. So that is fine. I'm also looking here at my CO2. So my CO2 is at 41.1, you can see there. So that means too that my patient is hooked up, because when my patient and the tube is placed correctly, because when a patient is exhaling, CO2 is going to be registered. So we can see too that there is some fogging going on in the tube here. Can you see the fogging? You can see a little bit of fogging there. So that tells us too that the patient is hooked up, and the bag is rising and falling, which was another reason we know the bag, that the ET tube was placed correctly. So we are just waiting as Dr. White finishes up his sutures here, as I mentioned. We're going to have to explain to the owners here the recovery process. So recovery is going to take about 10 to 14 days for our patient here. So we want to make sure that our patient stays calm, isn't playing, isn't running, isn't doing anything that is going to damage the sutures within that 10 to 14 day period. So we want to be very careful of that, and we are going to make sure that we stay with our patient and we monitor the patient's mucous membranes and rest rate. Not across the room. We want to be right with that patient until that patient is able to stay by itself in a sternal recumbency position. So we're going to want to make sure that we follow all of those things when the patient is recovering here. The patient, we want to make sure, is still warm. We've got lots of blankets on the table here, and we're going to make sure that we do not take the tube out until the patient's sorry, pause.